Every province, from British Columbia to Quebec, has had their highest number of positive cases during the second wave, and all of them have been in the last few days. Manitoba is not immune. Like our neighbors across Canada and like every jurisdiction around the world, we have been chasing COVID for a while now. When we were abiding by the fundamentals, we were beating COVID. Then some of us lost our way. Now COVID is beating us. We need to get back to the fundamentals. We need to flatten our COVID curve, and we need to do that now. I believe, and I want Manitobans to know this, I believe profoundly that with the cooperation and assistance of all Manitobans, we can and we will get back to beating COVID. By taking these new measures seriously, we are going to save lives. We are going to protect Manitobans. We are going to protect our healthcare system when we need it most. En prenant ces nouvelles mesures au sérieux, nous allons sauver.
We will save lives, protect Manitobans, and protect our health system when we need it the most.
Brent, I'll pass it over to you for some news.
Great. Thanks, Premier. Good morning. I'm speaking to you today with a crucial message. We are truly at a crossroads in our fight against this pandemic. The measures we've had in place over the last number of weeks, while restrictive, have obviously not been enough. We continue to see our numbers climb. We continue to see increasing strain on our healthcare system. In just 1 week, we've announced more than 2,000 cases. We've been pleading with Manitobans to follow the fundamentals, to significantly reduce their contacts, and but the numbers continue to climb. It's clear that further action is needed, and this action is needed now to protect Manitobans. We have that responsibility to ourselves, to others, to our healthcare system, to our healthcare providers, as well as to the vulnerable populations. We are truly in this together. We need to turn these numbers around, and we need to turn them around now. Our plans are that these new restrictions will help halt the spread of this virus, to protect Manitobans and ensure our healthcare system can continue to function. Today we're announcing that the entire province of Manitoba is moving to critical or red on the pandemic response system, and additional restrictions will be added to the critical level. This short, sharp set of restrictions to stop the spread of COVID-19 in Manitoba and to bring the entire province under the same restrictions. The following restrictions will come into effect on Thursday for all of Manitoba. There'll be no social gatherings permitted. Social contact is reduced to members of your household only. Travel to and from northern Manitoba is restricted to non-essential, and non-essential travel is strongly discouraged. Retail businesses listed as critical services can remain open at 25% capacity. Those include businesses such as grocery stores, pharmacies, as well as others. Retail businesses not on the list can provide e-service, curbside pickup, or delivery only. All gyms and fitness centers must close. Sites that provide space for religious and cultural gatherings must close. Services can be provided virtually. Personal services, such businesses, including hair salons, barbershops, and sites that perform manicures, pedicures, and other aesthetic services must close. Restaurants must close to the public. They may be open for delivery, drive-through, or takeout only. All recreational activities and sports facilities must close. All casinos, museums, galleries, libraries, movie theaters, and concert halls must close. At this time, there will be no change to the K-12 education delivery. Schools and childcare centers will remain open, In part, we're making these sacrifices and changes so schools and childcare centers can stay safe and stay open. In many countries that have gone into second lockdowns, including many parts in Europe, schools have also remained open in those jurisdictions. In addition, we're not seeing widespread transmission of the virus in schools. Despite many cases that are community acquired, we haven't seen that translate into transmission in schools, not at least to high degrees. In addition, some older students have moved to remote learning, and it's even opened up more space for schools to work. Keeping schools and childcare centers open is important for children. It supports their learning and ensures a sense of normalcy for them. I want to thank the teachers and childcare workers for everything that they're doing. Everyone's worked so hard, and it doesn't go unnoticed. For Manitobans, it's now our turn to step up. By reducing our social contacts and focusing on the fundamentals, we reduce community transmission and will keep them safe. These restrictions are really in place to do one thing, to reduce close contacts amongst Manitobans. What we've seen in this second wave is many more contacts per case. We've lost track of those fundamentals. And we know in addition to these restrictions, there's other things that we can do. We can reduce the number of shoppers from your household to the lowest possible number. Send only one person to shop if possible. Work from home if possible. Reduce travel unless it's absolutely essential. And most of all, limit your contacts to your household only.